Good afternoon. That's what it is here in Ontario at Eastern Standard Time. We also want to say, though, good morning to those of you in the West, and good later afternoon for those of you in the further East. And we do know also that we have international attendees, so I think good day is the best approach here. I'm Jean Baynock, and I'm the Director of International Affairs and Best Practice Guidelines Center here at RNAO, the Registered Nurses Association of Ontario. And I am absolutely delighted to be introducing and facilitating this webinar today along with my colleague Heather McConnell, who is the Associate Director of Guideline Implementation here at the Registered Nurses Association of Ontario. So we do know there are a number of you who've joined us, and we welcome you. This is our fourth webinar we have had in this series. We have had previous webinars introducing the guideline related to care of persons with ulcers and diabetes, foot ulcers and diabetes. We've also had a session focused on implementation strategies for implementing clinical practice guidelines. And our previous session last month focused on a very critical implementation strategy, that of preparing and engaging champions. Today, our session will focus on a very effective organizational implementation strategy, which is called the Best Practice Spotlight Organization Program, or as we refer to it, BPSO. And in our session today, we will review a number of areas that relate to this program, and in addition are pleased to have a presentation from the field, if you will. So just moving then to get started with who we are here at RNAO, I'll just advance the slide. And I'm looking at how to best advance the slide here. Okay. So just bear with me for one moment. Good. So I've just really carried out the welcome message to you all. And I'll move on now. A quick background of really why we're here. First of all, I've mentioned we're from the Registered Nurses Association of Ontario. You can see from this slide we are the professional association of registered nurses in Ontario, and we see ourselves as the strong, credible voice of professional nursing with a goal of focusing on influencing healthy public policy as well as clinical excellence. And a key signature program of RNAO that influences clinical excellence is our Best Practice Guidelines program. And in addition then, the other large arm of why we're here with you on this series related to CPGs and their implementation is all about the Council of the Federation. A number of you may have heard of the Council of the Federation. This, in fact, is the gathering of the provincial premiers and territorial premiers who have come together to look at healthcare across this country. They have three particular areas of focus. The first is scope of practice. The second is focusing on health human resources, and the third, our area of interest, is focused on clinical practice guidelines. In each of the three healthcare areas, working groups were developed, and RNAO, along with the Canadian Nurses Association and Canadian Medical Association, were invited to be part of the working group for clinical practice guidelines. And part of our work, and I've attended a number of these meetings either with or for Doris Grinspoon, our CEO, and at these meetings, a key role for our group, the CPG group, has been to identify criteria for how we would select clinical practice guidelines for national implementation, and then identification of guidelines that met these criteria and selection of those that would be implemented across the country. For the 2012-2013 decision-making period, our group selected 2 CPGs, one the C Change guideline developed by the Canadian Medical Association that focuses on cardiovascular and related conditions. The second guideline was the RNAO guideline focused on assessment and management of patients who have diabetic foot ulcers. And we're absolutely delighted then to be part of these webinars to help introduce this guideline, and then as importantly, help talk about how can we make this happen across the country. And there are some very critical reasons for why we should be making this happen. They relate very much to quality of life. A number of us know very clearly that with diabetes, the complications that come from foot ulcers often lead to amputation. And this is a serious impact on quality of life, and in addition, a serious impact on finances, and has extreme financial implications for our healthcare system, as well as for individuals and families. So given those particular reasons, it's very important that this guideline that has been selected be successfully implemented across the country, because we know in a number of the areas that it has been implemented, there is a huge difference with numbers of limbs saved, affecting quality of life and, of course, cost. So as part of this, then, as I've mentioned, we're leading our national seminars that will bring this guideline into practice. I did also want to focus on another national initiative, and am very delighted to do this. We have partnered at RNAO with the Canadian Association of Wound Care. And the Canadian Association of Wound Care has had a long interest in, of course, wound care and care of diabetic foot ulcers and complications. It was really, as they say, a no-brainer that we come together to focus on care of patients with diabetic foot conditions. And we have recently partnered to present to the interprofessional population across the country a new e-journal called Diabetic Foot Canada. And with this partnership, we will be able to bring a number of sets of resources in articles and in brief sets of communication, information about the latest evidence for effective care of patients with diabetic foot conditions. The journal is together. You can see on the slide the cover of the first issue, which we're absolutely delighted with, and the new release of this issue is expected sometime this month. So watch for your emails. We will be sending it out, of course, to all of you who've been part of our webinar series, and then ask you to send it far and wide so that all healthcare professionals have opportunity to benefit from this journal. Just a highlight of the webinar series. I've already mentioned this, so I won't go through the sessions we've had, but the upcoming sessions are July and August sessions with specific dates to be determined, are focused really again on implementation strategies. So the fifth session will really take you that next step. You know about the toolkit, implementation strategies, help you look at how do you actually get started? How do you conduct a gap analysis using a guideline and looking at what you already do? The sixth webinar session will focus on evaluation strategies, and there we will provide much more information about nursing order sets. You have already heard a bit about this, and also Enquire, which you've also heard a bit about, but there will be much more extensive information, and then how you can use that information in your work. We ask you to feel free to access the archived webinars. The URL is there on the slide. I know it's a bit long, but I believe Josephine sends them out to you at the end of every session, so you can very easily click on that link. Just today, as I've mentioned, I'm presenting here with Heather McConnell, Associate Director of the IA-BPG Center, and her focus is very much on guideline implementation and knowledge transfer. So she's our expert in the implementation focus. And then we're very happy to invite Barb O'Neill. Barb is the Chief Nursing Executive and Chief of Interprofessional Practice and Organizational Development at Blue Water Health here in Ontario, Canada. And Blue Water Health is currently in cohort 4 of our best practice spotlight organizations, beginning their second year of a partnership with RNAO to implement multiple guidelines. And Barb will certainly talk about the process of being a BPSO. So for our agenda today, I've already looked at some of the overview of the IA-BPG Center. We'll move next into the overview of the guideline. You can see the official title there, Assessment and Management of Diabetic Foot Ulcers in People with Diabetes. And then Heather McConnell will take us through the background for the Spotlight Organization Program, highlighting the critical criteria to be a BPSO, and then the expected deliverables. As I mentioned, Barb O'Neill will provide lessons from the field, a real up-to-date application session, really, to let us know what is it like to be becoming a BPSO. And then we will have time for questions. With our guidelines, we always like to give a little bit more background that our program is, we're very proud of this, has been funded by the Ministry of Health and Long-Term Care here in Ontario since 1999. And our mandate is really developing, disseminating, and actively supporting the uptake of clinical practice guidelines, as well as healthy work environment best practice guidelines. Excuse me. In addition, we focus on the evaluation of the impact of these guidelines. Excuse me. I do want to stress that while guideline development through a very rigorous process is a large part of our mandate, we are as interested in getting these guidelines into the heads, the hands, and the hearts of nurses so that patients can benefit. You can see the model here, which really demonstrates in one page what the entire focus of our program is. The top focus or the top circle identifies our rigorous guideline development focus. You can see the 7 steps there that involve a panel of experts, a systematic review process, developing a draft guideline, incorporating evidence-based recommendations, moving to a stakeholder review, where I would stress that for those of you who are interested in particular guideline areas, on our website you can sign up to be a stakeholder reviewer. Following that stakeholder review, we revise the guideline based on their feedback, move to publication, and then we're committed to a 3 to 5 year guideline review. You can see in the next 2 circles, the one on deployment and implementation is what we're really focusing on in this set of webinars. Today is BPSO. We've spoken about champions, and we will be talking about order sets in the week following. And then you can see the next circle in the lower end of the page, evaluation and monitoring, the number of ways that we are identifying critical outcome indicators, and then through NQuire, nursing quality improvement for reporting and evaluation, we will be measuring the effectiveness of our work using the indicators. And all of this is really for the benefit of providers, of patients, organizations, and society. So we're very keen on looking at how we impact the outcome. The goals of our program very much focused on improvement of health care, whether it's through reducing variation, which is what guidelines enable us to do. It moves us away from traditional practice with everyone following their own tradition or how they were taught, towards using best evidence in a systematic, consistent way. It also helps us to transfer the latest research evidence into practice. And this is a challenge in many industries, businesses, organizations, not only healthcare. How do you transfer the latest knowledge into the actual practice? We also see the guidelines assisting with clinical decision-making, helping us identify gaps, and of course, stopping interventions that have little effect or cause harm. And lastly, because evidence-based care is cost-effective care, we do see this program reducing healthcare costs. So I'm going to just provide a very brief background of the assessment and management of foot ulcer for people with diabetes, CPG, which was released March 2013 on the internet. It's now available in hard copy, and if you're wishing a copy, you could certainly go on the website to identify how to order one. We have a minimal charge for hard copy versions, but it is freely downloadable on the website as well. I always want to acknowledge our guideline development team led by Laura Teague from St. Mike's Hospital, a wound care specialist par excellence. The expert panel, which included nurses, as well as members from other healthcare professionals, Karen Bruton, Patricia Coots, Lori Goodman, Christine Murphy, Heather Nesbitt, Deirdre O'Sullivan-Drombolis, and Ruth Thompson. And they've done a phenomenal job with the guideline. We had a wrap-up meeting, as we do with all of our panel, and they're so excited to see the impact of their work, even though it's such early days with the new edition coming out. And then I want to acknowledge the number of RNAO staff who were involved either from the perspective of being research assistants and working with the librarian and the systematic review, to staff who made sure that all of the administrative and follow-up was done, to staff that provided the support related to the clinical content, so our RN and also staff in Monique Lloyd and myself who make sure that the guideline follows our rigorous standards. And then our external stakeholder reviewers who contributed much to the refinement and finessing of this work. The purpose and scope, so for this guideline, the very overriding purpose is how to address and manage the care of persons with established diagnosis of diabetic foot ulcers. So the guideline provides evidence-based recommendations for members of the interprofessional team. So it absolutely includes nurses and other members of the team, and looking at very targeted at providing care in all settings, but to people who are greater than 15 years of age, who have type 1 and or type 2 diabetes and have the established foot ulcer diagnoses. The research questions which directed the systematic literature review and then the rest of the work that arose from this evidence focused on 4 questions. What are the most effective ways to assess foot ulcer in clients with diabetes? What are the most effective interventions to manage foot ulcer and prevent re-ulceration? Thirdly, what healthcare professional education and training is required? Because one of the things that's important to continue to remember is that our guidelines include practice recommendations as well as recommendations that focus on education, so the professional has the appropriate background to do the work, carry out the practice recommendations, and then fourthly, focus on organizational recommendations so that the appropriate policies and resources can be in place in order to support the professionals to carry out the best evidence-based practice. So our last question there was how do healthcare organizations support and promote the optimal assessment and management of patients with foot ulcers. So our recommendations, we have 19 in total. There are recommendations focused on practice that include 8 in the area of assessment, 4 in the planning area, 5 very specific implementation interventions, 2 on evaluation. There are 2 education recommendations and 5 organization and policy. And you can see the URL there for a free download of the BPG. Now, our implementation methodology. I mentioned to you that with the implementation arm of our work, we're very, very interested in moving guidelines into action. So we have identified strategies for individual level implementation. We have spoken about the Champions Network as well as learning institutes and e-learning programs. Nursing order sets will be talked about much more in the August webinar. The organizational recommendations, we have our Spotlight organization, which we'll talk more about today. And then our implementation level recommendations relate very much to overall projects that are either provincial or national in scope that are based on implementing a specific best practice guideline. So today, as I mentioned, our focus is on the organizational level, and we will discuss more clearly the BPSO and what it is and how you become a BPSO and what the expectations are. So I will turn it over to Heather McConnell to take us through the next set of slides.
Thank you so much, Imogen, and it's a pleasure to have the opportunity to speak with all of you today. I did want to mention at this time that if anybody does have questions, we will take questions at the end of the session, and you're welcome to use the chat feature at the bottom of the screen where you can type in your question and send it to the host, and that will be received by Imogen and myself, and we'll take as many questions as we possibly can at the end of the session. I also wanted to acknowledge that we do have a number of people on the line today who are members of our BPSO organizations, and thank you so very much for joining us. The key strategy that we're talking about today, again, is the Best Practice Spotlight Organizations Initiative. And the goal of this program was really to influence the uptake of best practice guidelines across all healthcare organizations to enable practice excellence and positive client outcomes. And so certainly we recognized fairly early on that having the guidelines was critically important. Working with individual nurses and other health professionals was important to encourage the uptake of best practices, but we really felt the need to focus on organizational strategies as well to give the infrastructure to support practice change. So the objectives of the Best Practice Spotlight Organization Initiative, there's four main objectives. We want to establish dynamic long-term partnerships that impact patient care through supporting knowledge-based nursing practice. We're interested in demonstrating creative strategies for successfully implementing nursing best practice guidelines, and certainly the many BPSOs we've worked with have definitely been able to identify some really very creative approaches for guideline implementation. We're wanting to establish and utilize effective approaches to evaluate implementation activities. So again, not just looking at the actual implementation processes, but what kind of approaches can we take in a systematic manner to evaluate the outcomes, and to identify effective strategies for system-wide dissemination of guideline implementation. So again, to be able to learn from each other and support widespread uptake. And I'm delighted to report that at this point we have 68 best practice spotlight organizations around the world that represent 310 distinct sites. And you can see that we have BPSOs all over the world. We have currently 52 best practice spotlight organizations in Canada. And we have a number internationally. We have two best practice spotlight organization country hosts. And what that means is that we are working currently with Spain and Australia, who are really acting as a hub, if you will. So in Spain, there is a key critical group that are actually coordinating the activities of 9 sites within Spain, and they're basically working to support those 9 sites using the RNAO methodology, but really they're taking the initiative to lead and support those 9 organizations within their country. Australia has 10 sites and growing, so again, they are taking a leadership role in Australia to support that work. In Chile, the RNAO is working directly with 2 BPSOs. In Colombia, we're working directly with 2 BPSOs, and in the United States, we're working with one best practice spotlight organization, which is actually a university, the University of Hartford School of Nursing. And this slide really just demonstrates the breadth and the range of organizations that are involved in the BPSO initiative currently. We have organizations that represent acute care, long-term care, home health care, public health, primary care, a huge range, including academic organizations. So we're really quite delighted that we've had such an uptake and interest in our work from not only individual organizations, but also groups such as a local health integration network through the Hamilton, Niagara, Haldeman, Brant, Lynn. So what does all this mean? Well, organizations partner with RNAO to implement multiple guidelines over a 3-year period in order to attain the BPSO designation. And there is a very formal process that we go through to really ensure that there's a rigorous approach to guideline implementation, but also opportunities for capacity building. We'll speak to those more in detail. But there is an application process and formal partnership with the RNAO as part of the BPSO initiative. There are specific requirements related to systematic implementation and the necessary infrastructure to support the uptake of the guidelines, so some specific reporting requirements, opportunities for knowledge exchange, a need to focus on sustainability planning, and again, measuring outcomes through the use of standardized indicators. And once organizations are designated as a BPSO, then they're really focused on sustained use, expansion, spread of guideline implementation, and also opportunities to mentor others in their journey through the BPSO. So I'm going to speak now most specifically about BPSO eligibility criteria. Organizations are eligible to apply for the Best Practice Spotlight Organization Program if they have demonstrated a commitment to evidence-based practice by implementing guidelines previously, that they've supported staff to participate in opportunities to develop capacity in evidence-based practice. So again, looking for educational opportunities for staff. They need to have strong and explicit support from the board, senior management, senior nursing leadership, and other key stakeholders within the organization. And they really need to be able to utilize the organization's vision and mission to leverage initiatives related to evidence-based practice and patient safety. So having those commitments at the very high level of the organization to support practice uptake. Of course, continuing on, a senior nurse leader in the role of chief nurse executive or equivalent who is part of the senior management team, and that's really important to ensure that this work has a place at the senior management table. Organizations also need to have the capacity to engage in research to be able to support implementation and evaluation of guideline uptake. Need to have demonstrated an ability to engage in successful partnerships within the healthcare community, so various different types of partnerships or projects that they worked on in the past. And again, organizations that have established relationships with universities who might be able to provide graduate programs in nursing. And again, this is really to help engage students in best practice guideline implementation. Now, there are a number of requirements or deliverables that are expected as part of this work. And so when organizations are joining the BPSO initiative, they really do commit to a number of really critical things. The first is to engage in a 3-year partnership with RNAO, and that partnership is reviewed and renewed annually, providing that criteria are met. They make a commitment to implement 5 clinical practice guidelines within their organization, and 2 of those need to be implemented organization-wide. And we found that the need to implement guidelines organization-wide really helps to support the uptake overall and really engage people in evidence-based practice cultures. And of course, there is a need to contribute financial and human resources to support this initiative. Now, at the completion of this 3-year period, and assuming all the deliverables are met, the organization is designated as a best practice spotlight organization. Now, the deliverables are categorized in various different ways, and the first category of the deliverables is really focusing on capacity building. And again, this is part of the deliverables as we really recognize that it's necessary for organizations to develop their staff to be able to help support guideline uptake and practice change initiatives. So the first capacity building requirement is that they'll engage a critical mass of nursing staff as best practice champions. They'll send nurses and other health professionals that are leading guideline implementation activities to our annual Clinical Summer Institute, which actually we're hosting next week. And we found that this particular professional development opportunity truly does give organizations and individuals an opportunity to really gain a more in-depth understanding of guideline implementation and what some of the requirements are and what some of the things they'll need to think about will be in not only the initiation of their work, but in the sustaining of their work. We're looking to establish and implement a process for developing a network of best practice champions and Summer Institute attendees within the organization. And again, that's so that nurses and other health professionals who are leading practice change have opportunities to meet and exchange knowledge with each other. Certainly there's an expectation that organizations will participate in orientation sessions. We have an annual knowledge exchange symposium to support our BPSOs. So we're really looking forward to having all of our BPSOs participate in that. We also have a structure in place as a BPSO coach, and that's an RNAO staff member who is able to support the BPSOs in the initial work of their BPSO implementation activities. And so we do expect that the organization will not only work with one of our staff members, but also with a mentor designate organization. Organization has had experience in guideline implementation, who is working with this new organization to help support them in their learning. The next category of deliverables is focusing on implementation, and as I mentioned earlier, the implementation and evaluation of a minimum of 5 guidelines, 2 of which are to be implemented organization-wide. And for our international BPSOs, we've identified a minimum of 3 guidelines, and that's in relationship to different levels of preparation and past experience with guideline implementation. There is a need to have dedicated BPSO lead to coordinate the implementation and evaluation activities, and also a need to have an organizational structure that will assume responsibility for monitoring the BPSO initiative through a steering committee. And of course, for each guideline being implemented, there needs to be a plan, and there needs to be an outline of specific activities that are going to be occurring, as well as a sustainability plan. It's never too early to start thinking about sustainability, and so we do expect that as part of this work, sustainability will be reflected on. Evaluation and research. As Imogen mentioned earlier in our teleconference today, there is a need to really focus on the indicators and the outcomes that we're achieving through this work. So there is an expectation that our BPSOs will collect and submit data to the nursing quality indicators for reporting and evaluation database. But they'll continue to conduct regular quality improvement monitoring activities within their organization. And also that they become an organizational member of the Nursing Best Practice Research Center, a research center that has been in place for a number of years now, REO in partnership with the University of Ottawa, with the founding partners of the NBPRC. And we've really recognized this again as an opportunity for practice agencies to work with researchers in areas of common interest related to guideline implementation. Opportunities to participate in research projects related to knowledge uptake, and finally, to facilitate upon agreement access to external researchers and graduate students for learning and research purposes. And of course, as we're moving further and further into our guideline implementation work in the BPSO initiative, there continues to be increased interest in the impact that this work is having on guideline uptake within organizations and some of the strategies that organizations are using to make this successful. Dissemination is a critical component of the deliverables as well, and so certainly we're looking for BPSOs to not only participate in presentations at provincial, national, or international conferences, but also to submit and develop manuscripts for publication and to share with others the experiences that they've been having related to guideline implementation through their BPSO initiative. One of the critical factors around our work with BPSOs is that we're really looking for opportunities for knowledge exchange and sharing. So there is an expectation that organizations who participate in this initiative will share their experiences either through resources that they might share on through our website, or present at our summer institutes and other events to share their learning. And finally, the next opportunity for BPSOs to share the work that they're doing on their website, so that not only individuals within their organizations know of the work that they're doing, but the broader community is aware of the work that they're doing to support evidence-based practice and enhance the clinical outcomes for clients. So, successes. We've had thousands of nurses and other health professionals involved in impacting the care of outcomes of over 1 million clients. And these are the results of a survey that we did in the spring of 2011. Time to do it again. Guidelines with greatest impact on client outcomes at that time were falls, pain, screening for delirium, dementia, and depression, and our suite of guidelines on wound care. Guidelines with the greatest impact on practice included falls, pain, again, screening for delirium, dementia, and depression, wound care, and professionalism. And some of the key sustainability strategies that we identified through that particular survey included staff orientation and education, policies, documentation records, and quality improvement program activities. And of course, we've also seen outcomes for clients and economic results. So at this time, I'm going to turn it back over to Imogen and have her introduce our next speaker.
Good. Thank you very much, Heather. That was a very fantastic overview. In relation to our next part of the session, Lessons from the Field, we're really delighted to have Barb O'Neill with us. As I mentioned, the Chief Nursing Executive from Blue Water Health, which is in Sarnia, Ontario. And Barb will present the impact of BPSO on an acute care organization. Now, just reinforcing what Heather has said, we have BPSOs across all sectors in healthcare, but it will be delightful to hear now from Barb and Blue Water Health, where they have used numerous creative strategies to, at this early stage, already make a difference in their organization through BPSO. So, Barb, I wonder then if we can turn things over to you to take the session from here, and welcome.
Thanks, Imogen, and thank you, Heather. Can you hear me all right? I'm happy to be here today, and I am assured that other organizations will have other stories. And I assume that our experience is typical of those other organizations. However, what I'm going to present today is truly our experience and our story. So just to set the context, Blue Water Health is a 326-bed, two-site acute care hospital located in southwestern Ontario. We have a site in Sarnia and a site in Petrolia, which is about 35 kilometers apart. And we are part of the Erie St. Clair LHIN. We are the largest employer in Sarnia-Lambton with 2,500 staff physicians and volunteers. And we have a stated care philosophy called patient and family-centered care. And as we began this work, we were really beginning the articulation of that care philosophy. Our programs and services are fully accredited. We will be up for accreditation again in 2015. And we opened a state-of-the-art facility in Sarnia in 2010. Our mission is we create exemplary healthcare experiences for patients and families every time. And our best practice branding is best practice every time. So we've modeled that very much after our mission statement. The next slide here is just a picture of our two sites in Sarnia, and I just wanted you to have the visual of where this work took place. And then I'd like to talk about our journey to BPSO. So as Irma Jean said, we are currently a candidate. We've successfully completed year 1 and are just entering year 2 as cohort 4. And as we began the journey, I really believed in my role as Chief Nursing Executive that it was critical to understand the levers to move the initiative forward. So first of all, it was critical to assess the environment and the timing. We needed to evaluate what else was going on, and a belief that there was, it would be ideal if there was an appetite to move to BPSO, if there was a pull or if there was an identified gap, and then to make sure that there were some strategic structures in place. And my belief was that at the time, those things were ready, we were ready. Then we needed to align our decision to proceed with our current strategic plan and our quality improvement plan. And I would suggest to any of those that are joining in that as you look at your strat plan, look for words like quality care. In our strategic plan at the time, quality care was one of our themes. And of course, BPSO fit beautifully with that. If you haven't named your care philosophy, and as I said, ours was patient and family-centered care, I would definitely recommend that it be clearly articulated to your staff before you begin this work or as you begin this work. And then I would also suggest that you look at your QIP to see if any of your targets have a best practice guideline to support them. And in our organization, one example was that in our quality improvement plan, we had a target to reduce falls. Our chief of staff, medical staff, had taken the lead on that particular priority. It fit with patient safety. And I had a conversation with him in the early days about what strategy we would use to move the dot on that particular indicator. And I had a chance to tell him that the RNAO best practice guidelines on falls was available to us. And of course, he wanted to have a look at it. And we were able to get pull on that particular guideline right from the start. So that was really important. Next, I attended the Summer Institute that we just heard Heather speak about. It was in Collingwood. My staff sort of lovingly referred to that as the summer I went to summer camp. It was a whole week. It was a very large commitment of time at a busy time of year. It took place in June, and of course, most of us, I think, are planning AGMs and so on. But I wanted to go because I had questions that I needed to get settled in my own mind, and I really wanted to model the way for the professional staff in our organization. I wanted to be able to clearly articulate to my executive colleagues on the board why we should submit the proposal. And when I left the Summer Institute, I was assured that we had a coach, Heather McConnell is our coach, and that we would have a mentor organization, and our mentor organization is Holland Lorview, and they've been wonderful. Another lever was that I fanned the flame at the top. I used an SBAR format as a communication tool to bring our board and executive council along, and I made sure that I had strategic conversations with the chair of the quality committee of the board so that he fully understood what it was we were going to engage in. And I was crystal clear from the start that this was not a project. It would have a beginning and it wouldn't have an end. And I called it legacy work. And quite frankly, who doesn't want to be involved in building a legacy? So people came along. And lastly, I set a realistic budget. I looked at the initiatives that were presently going on, and I deconstructed some things. For example, roles and reporting structures. I looked at our org chart to see where the allegiances and alliances were. I looked at what our investment was set aside for leadership development and was able to move some dollars from there into this as a leadership development strategy. And there were dollars in the budget around employee engagement that really could be moved to some of this work. So I would suggest sometimes it's good to be a little bit creative, not to necessarily look for new money, but to look for where there are dollars within the organization that can be redirected to this work. At the end of year one, I can tell you that BPSO is woven throughout our new strategic plan. We launched a new strat plan about a month ago. It's the 2013-2015 plan, and BPSO is woven into almost every theme and is listed in many of the goals. I included it in our strategies for our QIP, and again, we're still looking at reducing falls. A little bit creatively, we have a goal, a QIP goal around increasing patient satisfaction. And we've actually linked that to the 3 guidelines that we're looking at corporately: client-centered care, therapeutic relationships, and supporting patients and families through expected and unexpected life events. And we're really looking to increase patient satisfaction as those best practice guidelines are sustained and mature. We have 104 interprofessional best practice champions. Our target for year one was 30. We discovered that people were eager to step up to this opportunity. We have a physiotherapist who's leading falls. Our patient advocate is leading client-centered care. We have a social worker leading therapeutic relationships. Excuse me. So and we have nurses leading many of our initiatives. But just an encouragement that the interprofessional champions really appreciated being able to step up and be part of this work. Our fellowships, leadership opportunities are available for frontline staff through these fellowships. We've been able to have an ICU nurse who's a longtime employee step up to do a fellowship. She did the one on unexpected life events. Currently, I have a registered nurse in our surgical program that's working on the pain guideline. And we have a new proposal just accepted from one of our RPNs looking at the collaborative teams best practice guideline. We also created the manager of best practice as a full-time position. I guess if I had any advice, I would say make sure you have the right person in the role. I believe it needs to be a mattress-prepared nurse who has a passion for best practice and evidence-informed decision-making. the person that we have in our role in the interview said, this is the role I've been waiting my whole career to do. So there needs to be an energy around that work. And in our organization, the size of it, we thought we needed that to be a full-time position. We also aligned the work of best practice with our clinical educators through our interprofessional practice team. And I think initially they saw it as more work, but now recognize that it is their work. And all of our clinical educators are champions, and none of them are BPG leads, and that is by design, so that they can be involved in all of the initiatives across the organization. We engaged our physicians in the best practice guidelines. I was able to work closely with our Chief of Staff, VP Medical Affairs, and we introduced this work at the Medical Quality Utilization Committee, which reports up to our Medical Advisory Committee, and we did that right from the start. At our launch for BPSO, excuse me, our Chief of Staff actually spoke and set the stage for us to move forward with that. And this work that we were doing aligned beautifully, pardon me, with order sets, which is being led by a physician, so we were able to link with that work. Nurses Week focus and collaboration on knowledge was a change for us. It used to be that it had a lot to do with food, and this year we were engaged and delighted to do so in an RNAO media event, and we had what I called a little mini NLN poster presentation where our professionals from across the organization were able to display the initiatives that they've been working on in the past year. And we are looking forward to engaging in research and the work that we'll do with Enquire. Impacts on quality care. Our professional staff clarify practice decisions through evidence. They trust the BPGs. We no longer waste time debating the evidence. Paralysis by analysis is gone. Staff and physicians trust the evidence in the guidelines. They're confident in it, and they know that there is a commitment from the RNAO that these BPGs will be refreshed and that practice changes will follow based on that. Our cross-program teams, physicians, and allied health professionals work more collaboratively through the champions. As I said, some of the leads are in non-nursing roles, and they support one another across the organization. It's a bit of cross-pollination. It's working very well for us. Leadership is growing at the front line. Executive Council members round every Wednesday morning, and we have the opportunity to speak with care providers as they work. We engage them in conversation, and we've already seen tremendous growth in their confidence. There's still lots of room for growth, but they do tell us about how they're using the guidelines to assist in clinical decision making. I believe that there is increased confidence on the part of our professional staff to engage with patients and families. We've recruited patient experience partners, and our goal is to have them on every team. And there's tremendous learning about having these folks in the room at our meetings and sitting on our quality committees as we talk about our targets. It very much changes the conversation. Patients and families recognize the BPSO logo. Recently, we received a letter from a family from out of town who recognized our BPSO banner that was hanging in the atrium. And she wrote that it gave her a great deal of reassurance that her loved one was being cared for in an organization that was using BPGs. And the language of the BPGs is being heard at our quality committees. Board members are asking our business directors and medical directors about their targets, their BPSO targets, when they deliver their QI reports. And I guess perhaps the most remarkable for me is when I'm at physician committees such as medical quality or MAC, and we're discussing the outcome of something such as a QSIPA review, to hear physicians suggesting that we need to go back to the guidelines to see if there's something there that can help us with a specific recommendation. So that's very exciting. And lastly, I just have a story. I'm calling it an exemplar And I was recently, it's about 3 weeks ago, I was invited to attend the launch of the three, I call them the big three BPGs, the corporate BPGs, in our diagnostic imaging department. And at the front of the room, and it was a filled room, there were two new champions, neither from nursing. And they were telling stories about why they believed they wanted to engage in the BPGs. And one of the stories I'll tell you, I've called it cream in the coffee. They had heard from a patient that although it was hard to fast or not have any food for breakfast, what was really hard was not to be able to have cream in his coffee. And they went to the evidence and looked at who had made that decision and why we needed to continue for it to be that way, and discovered that that wasn't necessary. So they were actually making changes because it was the right thing to do and the evidence supported it, not because anybody had asked them to do it. What I was seeing was that they truly understand what becoming a BPSO means and what the BPGs can do. That they get it. They fully understand the importance of this work. And I can tell you that as I was asked to speak, I was somewhat overwhelmed with emotion, because I realized that from this little pledge at summer camp to seeing it really in practice was truly what it's all about. So I would say impact, it's hard work. You need a laser-focused vision. You need to have lots of encouragement and move all of the levers. But the impact is absolutely worth it, because in the end, the outcome is better patient care. Thank you.
Thank you very much, Barb. That certainly provided a very informative overview, and thank you so much for your personal reflection and how it really has made a difference. I want to rapidly move now to 2 slides before we have questions. If you are from Ontario and you're interested in being a BPSO, this slide is really how you get started. We do take a cohort of organizations in every 3 years. So the next cohort will start in 2015. So we will actually be starting in the fall of 2014 next year, and we'll release a request for proposals. And if you are interested, stay tuned. But in the meantime, utilize the Champion Network and the number of other programs in Ontario to help you get started. And make sure that your staff are being engaged in evidence-based practice. If you're outside of Canada, and if you're in other parts of Canada outside of Ontario, if you're interested in becoming a BPSO, contact us by email to express your interest. And from there, we move to having you review the terms and conditions that are outlined in a BPSO agreement that are very similar to what Heather has shared. And then once you review that and sign it, we begin the process right away with our support in helping you start the BPSO journey through the launch and development of champions. RNAO is very interested in and quite able to come to your sites to begin a train-the-trainer process, if you will, and offer a kickoff institute and champion development programs with at no cost other than, of course, travel, accommodation, any out-of-pocket kinds of expenses. But we are happy to share our knowledge in this way to get you started so that you can continue the process in your organization. I'm going to stop there, thanking Heather and Barb, but now turn things over to our listeners to see if you do have questions about anything that we've spoken about today. So the floor is yours, and we'll look for any questions or comments. I think we're having some questions coming, so I'll just ask you to note down your questions, and we'll see them here. What I would say is there are other, while we're waiting for the questions to be fully written, there are other organizations online that are in the BPSO program. Feel free to make your comments at this point or share any insights you've had along the way. I do want, our time is a bit tight. I haven't seen any questions coming. I did want to just close then by making sure you realize that we're here and available should you have interest in becoming a Spotlight organization, and also indicate to you we had a very successful BPSO session at the International Council of Nurses in Melbourne. It was extremely well attended and much interest internationally as well as locally in the BPSO initiative. I want to move then to our last slide. Please feel free to visit the RNAO website for further information about the guidelines, and our foundational BPG Institute is being held next week, coming very quickly, June 9th to 14th. We have overwhelming response, but if any of you are interested, keep Barb's comments in mind that it becomes a real transformational event and a great assist in how to revolutionize your organization with quality and evidence-based practice. So I will again thank Heather McConnell and Barb O'Neill for joining us. Draw your attention to the website and the fact that you can check into this presentation through our archived library, and Andrea Stubbs at astubbs@rnao.org would be available if you have any questions. Thank you all for signing in. Stay tuned for our next webinar, which will be in July, and is really focused on the nitty-gritty of getting started with the implementation toolkit and the guideline to set the stage. Thank you all. Have a great week. Bye-bye.